The magnitude of cancer certainly is increasing. As we said, we have 20 million new cases of cancer. Lung cancer now is the most common cancer. It's the most common cause of cancer death as well. It's really become very important in many different parts of the world, and it's a leading cancer in many countries.
Well, the World Health, we're here with Dr. Sutton.
Yeah.
Dr. Darian's here, and we're talking about this World Health Organization releasing these new sobering estimates this morning on the global burden of cancer. And what does that mean? We're going to break that down and how you can take some steps right now to protect yourself. Dr. Darian, thanks for coming in.
Thanks for having me.
Let's talk about these numbers, because when you talk about globally, these cancers, I mean, it affects so many people, as we know, but when you actually see it in data form, it's staggering.
It's staggering. Some of these numbers, when you look at the year 2022, the rate of new cases of cancer was around 20 million. When you look at the projections for 2050, that number is expected to increase more than 75%. We're talking about 35 million cases or new cases of cancer, and that includes things as lung cancer, breast cancer, prostate cancer, and so on.
We've made so much progress, though. We talk about it, these studies that make these phenomenal breakthroughs.
Yes.
But as far as we've come, it's something else that's blaring with these numbers. And speak to that.
The disparities and the differences. When you look at the availability of access to care, and most notably preventative care, you know, talking about a diagnosis when I'm in the emergency room and I'm seeing a patient who comes in after missing preventative screenings, after foregoing visits with the doctor, and I'm seeing them at the end stages of their disease. Many people think that that's a choice, but when we look at the access to care, for many, that is their only option. And so what concerns me is that we see this incidence or the new rate, but we're also seeing in certain countries that don't have access an increase in mortality or death. And that is what's concerning.
Now, before you get too upset about these numbers, because they can be upsetting, we're doing some things right. People are living longer, our population's living longer.
Absolutely.
But what can I do in general, and more than just, well, drink water, and, you know, what can I do?
You know, that is always discussed, especially if you look at recent publications, for example, from Harvard Health. They do this thing called 10 Commandments of Preventing Cancer, and I think it's interesting. It starts out with things you would expect: getting sleep, eating a healthy diet, avoiding diabetes. These are things that we all should know. But I think what's more interesting, the effect of things that we do every day. Sleep, for example. You know, not getting enough sleep collectively adds up over time. I know I'm speaking to three people
you're
probably.
you're the wrong audience for getting sleep. Probably you don't get enough either, right?
Managing stress, managing our diet. When you look at the increased rates, specifically, we've talked about this before, in younger audiences, increasing rates of new cancer diagnosis. Many suspect that our processed foods might be associated with that, and I highly suspect that as well.
But as much as we do that, it's just mind-boggling and so hard to keep up with it because, you know, great diet, but then you're also dealing with some environmental issues. We're talking about like microplastics and all these things that a lot of us are exposed to. Smog.
Absolutely. These are toxic substances that collectively over time can have a negative effect, and the longer we live, the more exposed we are. So I think as a population, as a community, we have to pay attention to our risk factors and avoid them. When we talk about forest fires and smoke inhalation, that's a time when I'm saying, you know, that's another time to grab that high quality mask. You should not be inhaling that.
Totally agree.
In general, also talking about other factors that we can avoid, you know, obviously avoiding smoking as much as you can, avoiding drinking as much as you can. These are really key quality factors in life. Aside from that, checking in with your doctor. Getting those preventative screenings. We talk about the incidence or new rate of cancer, but it's really unfortunate when you have a case that has been missed by missing preventative screenings. I think it's really important to check in with your doctor. Mammograms, colonoscopies, discussions about prostate cancer. These are really important.
Yeah, I mean, I'll take the unofficial beating for that. I'm someone who doesn't like to go to the doctor. I'll push off my appointment every time. So give us the round. Tell us. I mean, we should be getting these screenings what, after 40?
I think at 40 we should start having discussions with our doctor about what is our risk. We should start having discussions with our family about their history, so that when we walk into the physician's office, we're more informed about our personal history, and then we should discuss what is the plan. You know, making plans a year ahead of time, I think is really helpful. I also, believe it or not, do not like going to the doctor. I know. I think it's because it's a moment of
vulnerability.
Vulnerability.
It is.
And I feel it is very much in that vulnerability sense, and I think there's a lot to be said about that, especially as a man. As men, we constantly feel as though we need to be strong and can't be weak.
No, I agree with
you too.
See, I use my doctor visit when you come in. Probably not. We got to do something more. Dr. Darian, thanks for
doesn't count.
Send you the invoice later.
Thank you. Yeah, I bet.
Thank you as always.
Insurance. All right. Thank you, doctor.
Of course.
Coming up, we're going to